Hi everyone. I'm going to give everyone a minute or so to log on and then I'll get started. We have a little over 120 people registered, which is super exciting. And while we wait, everyone who comes in will be muted and have their video turned off, but please feel free to ask questions in the Q&A chat. I'll do my best to answer questions throughout the presentation, but there is time for questions at the end. And I'll be recording this webinar as well, so you have access to it afterwards. If you are on your computer, feel free to have www.broadstreet.io ready if you'd like to build a CHNA with me. Okay, so let's get started. Thank you all for joining us today for completing your Community Health Needs Assessment, or CHNA, in times of COVID webinar. We realize it's a challenging time and we greatly appreciate you being here. So my name is Lizy Pierson and I'm the Director of Outreach and Engagement here at BroadStreet. So today I want to learn more about you and discuss common challenges that you've faced when creating your community needs assessments. We will then learn about BroadStreet and how BroadStreet can help with your needs assessment and IRS requirements. Then I'll jump over to www.broadstreet.io for the demo. And finally, we'll learn about the next steps. So we're seeking input from our members to help guide BroadStreet priorities. So first, I'd love to get to know all of you a little bit better. I'm going to open up a poll. Okay, so you should all see a poll pop up on your screen. So what best describes the organization you work for? And what are your current pain points for completing a community health needs assessment? So I'm going to give you guys a minute or so. I'll give it about another 30 seconds. All right, I'm going to end the poll. Looks like okay. A few more people are still voting. Okay, I'm going to share the results. So it looks like most of you are from nonprofits, nonprofit hospitals, and other nonprofit organizations. A lot of you work in public health. You have a few educators and students, and takes a lot of time, costs a lot of money. You don't have enough people or resources. You have multiple community health needs assessments, and COVID is a problem. So thank you for sharing. Okay, so BroadStreet is a software company based out of the Midwest. We have a strong social vision and mission. At BroadStreet, our vision is by achieving victories in every community across the country, we will leave a better world for the next generation. And our mission at BroadStreet is to ensure that community information is beautiful, accessible, and easy to use. Basically, we want exploring community data to be fun. So we're here to serve you, and we believe that data should be a conversation, not just numbers on a page. We want the data to be shared around the table with your community partners and key stakeholders. If everyone at the table has different geographies or service areas, that's okay. We're made for that, and you can explore as many areas as you want, and you can even compare them. So community data is not just about pulling something together for that final submission to the IRS. It's a way to open up a meaningful dialogue with your colleagues and community partners. It can help uncover areas of need and find great opportunities. So having said all that, yes, we can also help with your IRS requirements. We can help you define the community you serve, describe demographics in your community, assess the health of your community, document the community health needs assessments in a written report, make the CHNA widely available to the public. But one thing we cannot help with is receiving input from stakeholders. Excuse me. However, you can add this information to your report on BroadStreet once you have collected the data. All right. So if you'd like to walk through the demo with me, please open up BroadStreet.io. If you don't have an account already, it's free to sign up. So I'll give everyone a minute or so to log on if you want to join. Okay, so here's the home page. The entire website is built on cards. So you can see here. These are your tool cards that are connected to a wizard that helps you build your report. Over here on the left navigation, you can explore your saved areas. So these are some areas that I have saved. We can also look at our favorite cards under my favorites. So these are different types of cards that I found really useful, or I like to use them a lot in my reports. So I have them saved to my favorites. So this is what a data card looks like. And you can see that they're all interactive. You can compare to the US benchmark. You can scroll over. We can also click on the Stories tab. You can see here that these are several different stories that I've created. Also, we have our data dictionary. So here we have over 200 health indicators. It says 269 results. So all of our data is up to date and will always update when new data becomes available. And this will automatically reflect in the reports that you've created. In the data dictionary, you can click the info button to see the methods for all of our indicators. So the methods are also available at the footer of any of our data cards. So you can filter by the United States, by state level data, county level data, zip codes, the city, the census tract, and you can filter by the years. We also have a map room where you can explore all of the data side by side, or you can layer the data. You can get to this by clicking on the maps on the left navigation panel, or you can stay for the map room, or you can even go to the map tool card. So here's a map tool card, and then here is the maps on the side. And I'll come back to how to use the map room later. If you ever need help, there's a link to our Learning Center in the left navigation. So down here. So if you ever hit a roadblock, you can always come to the Learning Center and type a question. We even have videos to further explain. And if you need help, you can always press the toggle button and talk with our chat bot. So as you can see, BroadStreet has a variety of reports and templates to choose from, like the demographic report. We have the community indicator report, the area deprivation index, adverse childhood experiences, and the food access report, to name a few. So you can even create your own story. And we're always building more stories, and we'll talk more about how you can be a part of that discussion later. So in a second, I'm going to click on one of these and we can build a story together. So now that we're oriented, let's begin. So I'm going to do a cooking show style and show you the final fully baked report first before we show you the steps on how to make it. Here's our little chat bot. So here's an example of a final report. You can see that I customized the favicon up here. I have your logo, literally, and I changed the banner color. I have my title, the date, the collaborators. So my dog helped me with this one. I changed the featured photo. You can see all of the cards that we have available and they're interactive. I added my own section for COVID-19 data and trends. I added a section for interviews, and our interviewer said that BroadStreet is awesome. We have a section for measures of vulnerability, so we can see which areas are more deprived than others. We have a references spot at the bottom. And then also at the bottom, you can see all of your collaborators. The more collaborators you add, they would show up here. So we can share this report through a link and we can print it as a PDF. So first we can press share up in the top right-hand corner. And we can do copy link, read only. Then the link's copied and you can share it on your website or you can share it via email. And then we can also print this as a PDF. So we're going to go up to File. Let me just exit out of here. File, Print. More settings, and then Open in PDF Preview. I'm going to wait for it to load. All right. So here is what the PDF would look like. It's the exact same thing, but in PDF form. Imagine that. You can see all of our cards and all of our sections that we have. So first, we're going to create a community indicator report, and it will have important information like demographics and health outcomes. And now that we've seen the finished product, let's go through the steps on how to create this. I'll show you how to edit it and how to add your branding, and then after we'll explore how to build a story from scratch. So let's get started by clicking on the report we want to create. So we're going to go back to BroadStreet's homepage. And we're going to click Community Indicator Report because it's the most similar to a community needs assessment. Here you can decide if you'd like to create a new area or use an existing area. So let's click New Area. You can search by county list, zip code list, or by cities, towns, and villages for a comprehensive report. For now, let's do county list. It looks like we have a lot of people from the Baltimore metro area, so let's pull counties from there. So let's type in Baltimore City, Baltimore, Maryland. Let's do Harford County, Carroll County, and Howard County. So we'll call the report Baltimore Webinar. And then we generate the area. So when we generate the area, we can see what areas are included. The county list is the primary area, but if data is only available at the city level, we can use the city list as well. The city and zip codes are considered backup areas. So here we can see all of the cities and zip codes listed. So there's a lot. Now we're going to press Next in the upper right-hand corner. And that's it. We've done the secondary data analysis for you. So I'm going to press View. And this is the rough draft of the report with 0 edits. So we can see the logo, the date, title, collaborators, suggested text once it loads. And as you'll see, it's very similar to the report I just showed you. Looks like I'm having some technical difficulties. Oh, here we go. Okay, so we can see the picture here is different, the logo is different, the banner is a different color. Still me, but I don't have my dog Bob who helped me. All the data. I don't have the section on COVID here. I had to add that. Okay, so it's the same report I just showed you, but we haven't customized it yet. So if you'd like other data in this report, you can add cards from the map room and other stories that you've run. And I'll show you how to do that in just a second. So obviously there's some things that we want to edit, and we showed you the share button before, but now we're going to use the edit button to edit the story. And this can be found in the upper right-hand corner. So this is the story editor where we edit the story. And as you can see up top here, there's a settings button, a shuffle and cards button, and a save button. The shuffle card button allows you to move things around. The view button will take us back to where we just were, and then we can save our story as we add new things. Now let's customize the report by adding a logo. We're going to go up to Settings, Layout and Look, Colors and Brand, and we're going to name the organization Baltimore Webinar. Let's change our hyperlink colors to a dark gray, the header color to a light gray. Let's change our logo to, let's do your logo, and the favicon image to your logo again. And we can press Save. So now when we press View, we can see these changes in our report. So here's your logo, the banner, the image up here changed, So we can also change the text, and you can use a combination of our text, you can use your old needs assessments, and you can write new text. So for example, we can delete the special note from Broad Street, and we can say our community is Baltimore metro area. So that is how we customize our text. And say I want to shuffle these cards around, and I think that the median family income is super important, so we're going to add it up top. Then we're scrolling through the data cards, and I don't really think air pollution is that important, at least for this report. So I'm going to remove the card, and we can always add it again later. And then let's move health insurance up, and we'll move income status over. We can save it. And then when we press view, we can see our changes reflected in our report. So we moved up the median family income, and then air pollution is no longer listed. So I really want to compare data. So I'm going to favorite race and ethnicity because I really like this card. And I also really like health insurance. And then we can look at this side by side with other areas, which I'll come back to in a moment. So I'm going to pose another scenario to you to really demonstrate what cards can do. So what if you're on your way to a key stakeholder meeting and you want to compare the demographics of different areas? With cards, it's easy to create totally customizable stories. So let's go back to the home page. And we can click create a new story from scratch. We'll edit the story and we can rename it Comparing Data for Our Meeting on November 12th. And you can see that we have a totally blank story. So the template's similar, but we haven't added anything yet. And let's rename section 1 to Comparing Data. And let's press save. I want to add my favorite cards from the community indicator report that we just created and some other reports that I have to this blank report. And there are two ways to do this, and I'll show you both ways. So first, I want to go to my favorites. And then you can find the cards that you want and press the save button. So we really like health insurance. So we're going to save the card to our community indicator report. You can save it to the introduction, and then let's save it to comparing data for comparing our data for our meeting. And I like the race and ethnicity card, so I'm going to do comparing data for our meeting and save it under the comparing data tab. This area deprivation index score map is really awesome. So we are going to add it to comparing data for our meeting. And let's do percent of population with high school education. So now we can go back to our stories and we can click comparing data for our meeting. And we can see the 4 cards that we just added show up on our report. So to compare the data, let's go to edit. And then we can do the same thing that we just did in the favorites, but add it from the report. So I want to add this health insurance card to comparing data, and it'll show up underneath. And we're going to do the same thing for each one. So to compare the data, let's go to My Saved Areas and create a new area. So you can see here that the area tags are a little bit different on each one. I even created one for my grandparents the other day so I could tell them about my job. So let's go to My Saved Areas and create new area. And I want to create one for a health network that spans over multiple counties within Maryland. So let's do county list again. And we'll type in Garrett, Maryland, Washington County, Maryland, and Charles County. Generate the area. So here you can see that the areas don't have to touch to generate the report. The data will still be pulled from all the areas included. So let's name this, let's call it Maryland Health Network, and save the card. So you can see our new card appears right here in Maryland Health Network. So I'm going to go back to comparing data for our meeting. And I'm going to replace the area tags. So you can press edit. So we see all the X's up here and then it says replace the tag. So I want them all to be the same at the top. And we can search for our tags. Baltimore webinar, or we can scroll down and find our tab or find our tag. So I'm going to do the same thing at the bottom, but with the area we just created. So Maryland Health Network. We're going to search Maryland Health Network. So now that we have the data side by side, we can see that the data is really similar. So similar in insurance, a little bit different with race and ethnicity. The area deprivation index, they just have different maps, and the percent of the population with high school education is the same. In this report, I also want to add a couple of sections. So I'm going to add a section for COVID data, and I'm also going to add a section for interviews with the stakeholders. So we can go to add a section above, and here are the different options you have. So you can do a header with text and cards, a header with cards, header and text, a banner with text, or banner with an image. So I want to do a header, text, and cards for the COVID data. And I want to add another section, just header and text for, I forgot to press save, stakeholder interviews, and we'll add COVID data. So since we don't do primary data analysis, this section is make sure that you're still compliant with the IRS requirements. So you can say, everyone I interviewed said BroadStreet is great. So now I want to give you a tour of the map room. And now that we have these two stories, we can add our COVID data, and we can add that to the community health needs assessment this year. So we're going to go to maps, make a map. We're going to do my saved areas and click Baltimore webinar, because that's what we've been working with. And then we press next. We're going to press add data, and up will pop the same thing as the data dictionary. And again, you can see that we have over 200 plus indicators. So we can create a map that just showcases COVID data. So we're going to type COVID up here, and I want to look at just the cases and I can press map. So you can see that all of our counties in the service area have over 1,500 cases of COVID. And I'm going to share this card and save COVID cases. And let's do comparing data for our meeting and put COVID data. I can also layer the indicators. So say I want to look at COVID, but with, let's do diabetes. And there's a lot of different indicators for diabetes, but I just want to look at diabetes in adults over the age of 18. So I can press map. And then we can go over here and press diabetes among 18 years and older. And we can adjust the transparency on the layers. So you can see as we lower the transparency for COVID cases, we have a better understanding of who has diabetes within this area. So it looks like diabetes isn't super prevalent except in Baltimore. I also want to save this to our meeting story, COVID and diabetes. And let's add it to COVID data. So now let's go back to our stories. And let's click comparing data for our meeting. So you can see that the cards were added to the COVID data section. So we can also share this with collaborators that we're about to have our meeting with. So I can go up here to share, collaborators, add, invite via email, and I'm going to add Tracy and press the enter button. So the invitation is pending, and when she accepts this, she has access to edit it as well. All right, so we've talked about how to have conversations with data and how to build larger indicator reports. So in summary, we bring community data into your stakeholder conversations through stories and maps. We can customize with branding and get a head start on your CHNA IRS requirements. And as you can see, there's a lot that you can do with BroadStreet to streamline your CHNA process and add COVID data. BroadStreet is free to get started, and we have transparent pricing on our pricing page. It's $34 a month once you reach the store limits of the free trial. Larger organizations are welcome to sponsor smaller ones, and coupons for discounts are always available. Our genuine hope is that you can get the data right away. After all, it's not just about the report, but the discussions beforehand. So what's next? We're trying to start a discussion of our own, and BroadStreet is building a national coalition for those working to complete community health needs assessments. We believe by working together, we can make the process faster, easier, and better so your organization can do what has become even more important during these times of COVID, prioritize the health of your community. Our goal is to have the best CHNA template by spring of 2021, and we need your help. So if you want to be at the table, please join us and have a say in new health indicators, data visualizations for cards, and new BroadStreet features and stories. You can even help guide our priority process. If COVID has taught us anything, it's that now is the time to work together. We already have a few new story templates planned, and these include maternal and infant health and violence and behavioral health. And we invite your ideas because all are welcome. So if you're interested in joining the coalition, please email me at lizy@broadstreet.io and I'll send out more information. So thank you all for joining today, and I hope you learned how to improve your CHNA process in times of COVID. If anyone has any questions about the CHNA process, please feel free to type the questions in the Q&A chat. And if I can't answer every question, I'll send a follow-up with FAQs. For those who will not be staying for the Q&A, have a great day, and thank you for joining us. So you can find the recording after the meeting. I'll send out an email sometime this week. Okay, so the data comes from different places, and we can check that within the data dictionary. So let's go to data dictionary. And you can press info on any of the health indicators you see. So for example, air pollution, this one comes from the University of Wisconsin Population Health Institute. So someone asked, is it possible to add your own data that is not already provided by BroadStreet? So currently this isn't a feature that we have, but it's something that we're working on for the future. Can these reports be integrated into our HCI website? So something that you can do is you can use the read-only link, and you can either post it on your website or you can add a picture and members or users can click on the picture and it'll take you to the report. Are there any other questions? Okay, let's see. So the data comes from different sources, which can all be found in the data dictionary under info. Someone else asked, do you have primary healthcare providers and their locations? I do not believe so. Are there any other questions? I'm going to give it another minute or so. Okay, I don't see any more coming in, but if you do have any questions, please feel free to email me at any time at lizy@broadstreet.io. Oh wait, someone said, will we get an email when the webinar data is available for download from the map room? So you'll get an email after the webinar is recorded. I think that answers your question. And data is currently available for download in the map room. Are there any other questions? Okay, thank you everyone for joining. I hope you have a great day, and I hope you learned about how to create your community health needs assessment in times of COVID. Bye.